Improving Postpartum Care, Getting Started on Quality Improvement. Hi, I'm Jane Taylor, a Quality Improvement Advisor. All people should receive comprehensive care during the postpartum period to assess their recovery from pregnancy and childbirth, ask about their mental health, and follow up on any concerns and address any chronic conditions that they may have. People with Medicaid and CHIP coverage have lower postpartum care visit rates than those with private insurance, and racial and ethnic disparities in care remain large. In this video, I'll share the quality improvement methods needed to get your Medicaid and CHIP program started on improving postpartum care in your state. A great way to begin any quality improvement project is with an aim statement, identifying what you want to improve. An aim statement identifies key parts of your project. What do you want to achieve? Who is your population of focus? How will you measure improvement? And by when do you want to see improvement? A good aim statement will help keep you and your quality improvement partners working together toward the same goal. Here's a sample aim statement on improving postpartum care to help you get started. This aim statement anchors the beginning of the driver diagram. A driver diagram is a quality improvement tool which organizes evidence-based processes or systems that can drive the change needed to help you achieve your aim. Next, you identify primary drivers. These are key processes, structures, or norms in place within your system that need to be considered to achieve your aim. For example, one of the primary drivers for improving postpartum care highlighted here is state options for covered services and benefits. Secondary drivers are the places, steps in a process, time-bound moments, or norms that identify the opportunities to produce improvement. The secondary driver highlighted here is payment to support evidence-based maternity models of care. We'll say more about these highlighted drivers later in this video. Secondary drivers lead to change ideas. Change ideas are activities supported by evidence, experience, or expert opinion. Building off the successes of others will help you achieve your aim. You'll find an example of an improving postpartum care driver diagram and a change ideas table, as well as a postpartum care toolkit, measurement strategy for postpartum quality improvement, and examples of how state Medicaid and CHIP programs have improved postpartum care on the Medicaid.gov postpartum care web pages. How can you get started on a change idea for your Medicaid and CHIP program? Although it may be tempting to go big, making a change for the whole state, it's best to start small and test your way into the most effective program and policy improvements for your state. Using small tests of change will enable you to determine whether an idea will lead to sustainable improvement in your program and with your beneficiaries before enacting policy changes. An effective tool for testing change is the Plan, Do, Study, Act, or PDSA cycle. The PDSA cycle helps you learn whether a change idea will work for circumstances in your state. Let's plan a PDSA cycle by testing an idea from the driver diagram and change ideas table on improving postpartum care. We begin with the secondary driver we highlighted earlier, payment to support evidence-based maternity models of care, and then review and select an idea from the change ideas table. Several state Medicaid and CHIP programs and their managed care partners have successfully improved postpartum care by engaging doulas in outreach, education, and support. The first step is to plan. Start by asking, what questions do you want to answer with this small test? For this PDSA, your question might be, will doula outreach to postpartum Purple Finch MCO members increase postpartum visit attendance? Next, decide what you will test and details like who will conduct the test, the subject of the test, and what tools or resources are needed to conduct the test. One of the most important elements of the plan section is to identify what data you will gather to learn whether the idea has promise. Did it work or not? Develop an approach that keeps the data collection simple and quick. Try not to use administrative claims or other data with lag periods. The data don't have to be perfect. You just want to learn quickly whether and how the small test worked. Finally, make a prediction. What do you think will happen as a result of your PDSA? Making a prediction will enhance your learning. When you've completed your plan, you're ready to do or conduct the test. Did your test go according to plan? Next, study the data to understand the results of your test. What does the data tell you? How did your predictions compare to what happened? What surprised you? The final phase of the PDSA cycle is to act on what you have learned from the test. In most cases, this means planning the next iteration of your test based on what you've learned. For example, in the next PDSA cycle, test how to remove a barrier that you learned about. Or you can test the change idea with a different population, in a different setting, or with more providers or beneficiaries. You could even test several things by doing concurrent PDSA cycles. In the example of a PDSA cycle, the data showed that the doula was able to reach 9 of 10 members. Additionally, 3 members had transportation barriers, in part because the members didn't know that Medicaid and CHIP offered transportation support. The doula was able to resolve this barrier and connect the members to their Medicaid transportation benefit so that all 9 members came to their postpartum visit. 1 member could not be reached and did not come to the postpartum visit. Through the PDSA cycle, the team learned that engaging a doula was a successful change idea that helped members get postpartum care. The first PDSA was in an urban environment where transportation was readily available. For the next PDSA, you decide to run a test with 5 postpartum members living in a rural area. In the urban area, the doula will expand her outreach to 25 postpartum people to learn and address other barriers to care. Remember that testing ideas concurrently will accelerate your progress. Continue testing and learn about your change ideas by addressing barriers to improvement and, over time, increasing the size of your tests. For example, if you started with 5 people, test next with 25 and then 125. As you conduct your PDSA cycles, create run charts to visualize your data. A run chart is a graph that shows performance on a process or outcome over time. Run charts often show data in week or month intervals. Displaying data over time will show the impact of your change idea and whether it is producing the desired results. The run chart shown here captures the data from our PDSA. From Purple Finch MCO's baseline postpartum visit attendance of 40%, the first test of doula support demonstrated improvement visit attendance that continued with increased use of doula services and contributed to meeting the goal of 80%. When you have confidence that your change idea will reliably improve postpartum care, you're ready to implement it broadly in the clinic or system where you are conducting your testing. Good implementation includes getting buy-in from leaders and others involved, including the people receiving the benefit. You'll want to make sure that the cost of failure, either financially or in terms of goodwill of your partners, is low. Broader implementation might require changes in behaviors, policies, or procedures, and might include training staff and securing more resources. After successful implementation, you're now ready to create a spread plan, a plan for expanding beyond the initial setting or population you tested into new settings or populations. As you expand, continue to collect data and monitor progress to make sure your change idea continues to have impact and the outcomes are sustained. What I've presented here, identifying an aim statement, using data to assess improvement, developing and conducting PDSA cycles, is called the Model for Improvement. Along with implementing and spreading change ideas, these are the best ways to transform ideas into strong programs and policies to improve postpartum care among Medicaid and CHIP beneficiaries. To learn more about the Model for Improvement and to request quality improvement technical assistance for your state's Medicaid or CHIP postpartum care improvement project, reach out to CMS through the Quality Improvement Technical Assistance mailbox, Medicaid CHIP QI at cms.hhs.gov. This communication was printed, published, or produced and disseminated at U.S. taxpayers' expense. For more information and resources, scan this QR code to go to the Medicaid.gov Postpartum Care Quality Improvement Technical Assistance website.